Good morning, everybody. We do want to start on time because this will be a very rich experience. If anybody on the panel wants my sunglasses, this is incredibly bright.
It's good for the skin, though.
Good point. Bring it on. My name is Red Schiller. I'm vice chair of the department and chief medical officer for the Institute. And want to introduce our panelists today. Unfortunately, Neil Kalman, our CEO and department chair, is unable to be here. We are incredibly excited to have these panelists in this experience this morning. I will be brief and we can get right to it. Today's presentation includes some really incredible, extraordinary people who are going to spend some time with us to talk about how to provide high quality, affirming care to individuals in our community who identify as transgender or non-binary. Our panelists have generously agreed to share their stories with us, to discuss their experiences navigating the healthcare system, and describe ways in which those of us who as providers or workers in healthcare can help create a safe and healing environment where they receive care and help us gain an understanding of the concerns that they have when they're seeking and receiving our care. And certainly our organization's mission as providers is to provide patient-centered care and help people overcome barriers. This is clearly a group of individuals in our community that can help us achieve that. I want to thank Dr. Robert Murayama, the Institute's HIV medical director, and helping us lead our organization in this effort. He'll introduce himself, the moderator, panels, and well as I want to thank Cecilia Gentili. Thank you, Cecilia, for helping make this happen. And just sort of one comment, in medicine, we tend to listen more with our head than with our heart. And today I would encourage all of us to try to listen with both. For many of us who were around in the early days of the HIV crisis, it was people with HIV that taught us how to care for them. This is a difficult lesson for those of us as providers to learn, that the people that we serve actually can teach us how to help them. And I think this is an emerging healthcare issue that will be discussed today that will help us do a better job, not only for this community, but for everybody that we serve, to be better listeners and to be able to provide better patient-centered care. Thank you to our panelists. Let's get started.
Good morning. As you heard, my name is Robert Murayama. My preferred pronouns are he, him, and his, and I'm going to be introducing my co-moderator, Cecilia Gentili. We decided to leave the introductions as really short because we felt it was more important to hear what our panelists have to say. Cecilia is the Managing Director of Policy and Public Affairs at GMHC. Cecilia.
Hi. Hi. Yeah, better. Good morning. Thank you so much for being here. This is really, really important for me. I had an opportunity to do some trainings in some schools, and I asked the students once, is this a part of a series of classes that you have about, LGBTQ health? And they were like, no, this is the only class that we have. And then I said, maybe I shouldn't blame, medical providers sometimes when they don't know about my body, but blame the educational system that doesn't teach them, right? So when I have an opportunity to just, help providers, learn more about, the realities of and the bodies of a trans person, is always super good to do it. So I'm super happy to do this. My name is Cecilia Gentili. My gender pronouns are she, her, and hers. I am a 46 years old transgender woman. I identify as a woman of trans experience. There's a part when you all look surprised when I do say 46, so I'm gonna say it again, okay? So I am a 46 years old. I know.
No.
Sounds. You can do sounds too. I'm a 46 years old. Yes. It's the Argentinian gene. So, and I am from Argentina. I am an immigrant. I identify as a Latina, and I've been in this country for about 18 years. And I work at GMHC. So I'm very happy to have our panelists. And I'm gonna let them introduce themselves because I don't want to mess up who they are. So I'm gonna start from this end. Is that okay? If you can tell us your name. I'm just gonna put some things out there, and you choose whatever you wanna share, right? Name, gender pronoun, age, if you want, and how you identify in terms of gender, and how you identify as a sexual being.
Good morning. So my name is Graham. I am 25. I use they, them, theirs, and I identify as non-binary and queer.
All right.
Right?
And next to them?
Hi, I'm Eve B. Golden. I identify as a trans non-binary person. My pronouns are they, them, theirs as well. And I'm so happy to be here. Cecilia rocks. and nobody can believe like her age at all.
Right? Finally, somebody notices.
Hi, my name is Murayama Sunny Shiroma. I'm originally from Japan, but I became American. And I am 60, I'm open. I'm 61.
Wow, that's like.
And pronoun for me is she, because I think it fits me and it's easier. And what else? Is that, so I was born in Okinawa, Japan. And so when I was born, I was a somewhat American citizen because Okinawa was like a Puerto Rico. So somewhat American, and that's when I was born. And what else?
How you identify in terms of gender?
Gender transgender. And my sexual orientation is heterosexual, meaning that I attract to opposite gender.
Good.
Is that clear?
Yeah, that is awesome. So to start a little bit, I have many stories about myself, but I'm just not gonna try to hijack the whole thing. So I want to hear from all of you. And if you can tell me a little bit about, your experiences in healthcare, focusing in, what works for you when you go and see a medical provider and what could be improved or be better. So whoever wants to go first, I'm just going to give a little bit of me. I have an opportunity to have a primary care provider that understands my body and is great with me. But usually my problems are when I have to go to, for example, the emergency room, or when, I have to go and see a provider that is not used to see me, that doesn't know already who I am, right? When I have to go and see a specialist, that's problematic. But I am lucky enough to have a medical provider that understands my body, that understands who I am, that understands who I have sex with and how I have sex with. And, I'm very fortunate, for that. But I want to hear from all of you a little bit about your experiences in healthcare. You go. Oh shit is totally fine.
Thank you. My mic wasn't even on. I guess if I were to start before I get into broader discussions of the healthcare issue or blessing in some cases, I think I wanted to start with developing a sense of self and self-definition as a child, and that these are things that I don't know. I feel as though now I'm very fortunate that I am in a city and that has a Callan Lord, for example, where I could have like developed alongside of seeking out my own form of community in that form of like self-definition and like seeking out a LGBTQ clinic. But not having ever fathomed that that would be a part of my journey as a child when a lot of other people were kind of dealing with pubescence and sexual development. I was thinking so much like about my gender from like a very like a single digit age and how like certain images like really stuck out and certain conversations seemed like that I was so shut out of them, which is not all bad. I think that a lot of good has come out of creating my own community here and in my growing older. But I just kind of wanted to like kind of start there because I know that that's where a lot of my sense of definition began. And when you're thinking about like how the healthcare system could like really help you, it's partly to understand that like everyone has like the right and should be bold enough to reinvent themselves and to be able to transform their bodies and I don't know, to kind of create themselves for themselves and to define themselves for themselves. So.
That's really important, and like and also like how we introduce ourselves into a system that is terribly binary, right? And me as as a trans woman, somebody that is somehow binary in the idea of gender because I identify as a woman, a system that is based on the assumption that my body, because I am a woman, has to look a certain way and has to have certain parts. And that may not be the case with me. So, great, thank you for saying that. So, a little bit more about like experiences with medical providers.
Yes, thank you. So I have two stories I wanted to share, and one story is devastating for me, and the second is I think it has been improved. But two experiences I have, and from my experience, I don't know what I can ask you to change or better, but from my experience, I want you to figure out what could you do better. And my first story is, it was about 3 years ago, I decided I wanted to, because of my age, and I did not want to get the full surgery, and I just wanted to have testicle removed. So, ectomy? Okay. So the surgery, so my insurance only take one doctor. And doctor name, I am going to announce too, is Dr. I don't remember his first name, that was him. And he was the only doctor that he can perform with my insurance. And so I went there, and just make an appointment, show up. And when the doctor came, and we talked, and he said, "Okay, why don't you lie down on a bed?" And he said, "So open your stomach, so lift it up, and hands below." And so then he was standing, so I'm lying here, and he's standing, and he's very close here, and he's looking down and touching me like this. The circle is going up and down a little bit bigger than I want to feel comfortable. But in my head, my surgery is testicle, but I did not understand the reason why. But it's first time, first surgery, he's a doctor, he knows what he's doing. So I just let him. And at the same time, he was trying to convince me to have a full surgery. In my head, I was worried. If I have a surgery with this doctor, it might come out not how I want it to be. So that fear was there, but he's the only person who is going to perform, and at the end he said yes, he's going to do that. So I just let it go. And then all the consultation, everything is done, and then there was no call for surgery, nothing at all. So I was trying to call the number I was given. It was the nurse that is assigned to the doctor. The phone is always full of messages that nobody can leave a message. And then till now, the number is. So I did not know how to reach, but I try, and I worked with the case manager. I worked with Cecilia to help me, but nothing been done. So I thought, okay, something's wrong, but maybe it's not happening. But he's the only doctor, so I just let it go. A year later, I went back again. So when I went back the second time, it was the year after, because I really wanted to have my testicle removed. And so doctor shows up, and he looked at me and said, "Oh, you again." I was like, and then, same kind of like surface conversation. My mind, I just wanted to let this surgery get it done. So I didn't care what has happened, before, but I just wanted to let it go. And this time, he tried to wrap it up, not to like physical examination, nothing. So I said, "Don't you need to check, because I haven't seen you a year. Don't you need to check my testicles or, And he said, "Oh, I'll do it for you." And at this time, the examination was different from the first time. He asked me to stand up and drop my pants, and he get close right to my organ, my sixth organ area. And he pushed his face, and he was doing something. Because of my HIV medication and estrogen, somehow my sexual desire is much less, which I love. I like that at this age, And but he was going at it so much so that I started to get excited. The minute I felt I was a little bit excited, I pushed him. And that was the end of the examination. He didn't say anything. I was kind of embarrassing at the same time. I did not know what was happening. But in my head, I just wanted to get my testicle removed. If he's the only one, just go through it. And that was the last time. And so that was the experience I had. And of course, nobody called for that surgery, nothing, nothing happened. So this is my first experience. It was devastating for me. And the next one is much lighter, and it has been improved. I think it was early 2000. I was hospitalized. I went to emergency room with pneumonia. And when I checked in, because I did not know, I with high fever, and I did not know what was going on. I was just there, and I was happy that I was at the emergency room. And the issue was there is once I was taken to the front waiting area to the back, where put on the bed, and then nobody came to get me. I went to emergency room, I think, around 5 p.m. When I was taken care of in the back on the bed, I was the last person. That was 6 in the morning. And the nurse came to me and she said, "Oh, we've been looking for you. You were here." And I did not know what was happening because my fevers are high, yet the IV was making me warm. I was feeling a little comfortable, but I did not know the reason why she said what she said. But later I found out. The issue was my identification. At that time, my hair was blonde. And looking like this, I don't particularly look Asian. And I'm a little bit skinnier because of the medication, and I'm like gauntlet looking. So, and I am male. Gender is a male, sex is male. So the nurse was not able to track and just to look at me because I was totally different from what they are looking for. They are looking for Asian male, age at the time, 40 something? 40 something. And I wasn't fit to that group at all. So I was picked the last. But since then, I started to see the medical field that has been improved a lot. So that's a great news for me and for us. But if there's anything on your side need to improve that the patient, like myself, doesn't have to go through the same as I did. So that's my experience.
Thank you, Sonia. Thank you so much for sharing that story, though, both stories. I think that's, it's a very important point, we should never, assume that a patient looks like anything because, in your documentation, you had an M, you never know who your patient is going to be. I have a similar issue when I went to a hospital, to an emergency room, and I have an F. I had a 20 minutes it can be funny if I want to make it sound funny, but it wasn't funny because I had a UTI and I had a 20 minutes conversation about my period. Like, this nurse wanted to know about my period and it was like, I don't have one. And she was like, oh, because you're 46, you don't have one anymore. I'm like, no, I just don't have one. And she's like, oh, no. Oh, tú no entiendes el periodo. She thought I didn't understand because I'm Latina. And that was very offensive to me. And I'm like, girl, I understand you. I just don't have a period, right? Because I happen not to have, what it takes to have a period. And so, it was I was in pain and it was very difficult. So sometimes I feel like trans people, if you change your documents, you still have issues. And if you don't, you do have issues. It's very difficult, very difficult. So let's go to this side. How is healthcare for you?
This might not be the audience to say this to, but I generally avoid doctors for a lot of the kind of those same reasons, or the misgendering and the lack of accessibility in terms of health insurance. So I think it's really important to get people in the room first off. But I guess I'll share, I have two things. So the first time I went to attempt to get top surgery, to mastectomy, I had followed the WPATH standards. I had all of my letters. I had everything. When I went there, I had my consultation, and the guy at the end was like, oh, you know what? I don't know if you're ready for this. I don't know if you've really thought this through. I don't know if you're really who you say you are, only specifically because I said eventually I'd like to have children. And that was the only reason, because they assumed that at the time, because I was presenting male, that I would never want to have children. Why? I'm unsure. So that was kind of really crushing to not have the authority to identify myself or to present that way. Specifically also because I followed your standards, so no matter what we kind of do, we have this pushback. No matter how many ways we go, we're like, all right, I'm going to go through, the recommended 3 years therapy or whatever, the 1 year therapy, and being out for X amount of time does not particularly matter. And so the second time I went to get top surgery, I just went binary. I'm like, I am a guy, just put he, him on everything. Don't put they, them. I don't want there to be any type of kickback from insurance. So having to, on one side, totally erase your identity, on the other side, also be told your identity is invalid. There's just so many ways, just difficult to navigate that path. But on the flip side, a good experience that I've had in terms of healthcare was the first time I got a pap smear, which was mildly traumatic. Just in terms of gender, it was just awful. And I put it off for several years. But the doctor I had, we communicated the entire time. He wanted to make sure that I was comfortable, so he provided me multiple different options, whether it's get somebody to do it that you'll never, ever going to see again. If you want me to do it, if you want to, come back and do it at a different time, we could do part of it, then part of it later. So that's super incredibly important to be able to have that say in the type of healthcare that you get, and you don't just show up and they're like, all right, we're gonna do the thing. So that's also really, really important. And also being able to, while it was happening, he would also ask if I wanted him to communicate what he was doing, or just go for it, get it all over, ignore everything, don't talk, leave the room. So I think having, that experience was really positive in that way.
Thank you so much. I remember when I used to work with Dr. Murayama, we work a lot in how to make these procedures better for trans masculine or assigned female at birth folks. And it was like that we did a focus group, and all of this came about. So I'm so happy that that you had that. And yeah, about the letters, I remember I used to work at making it, and I used to write these letters for the providers. And I always had to when it was folks that identify as non-binary, I have to say, I know that you're non-binary, but I have to write a letter that has to be binary. So in this letter, I'm going to say that you are a man. And I know that you don't feel like one, but if we want you to have, your procedure, we have to write it this way. So it's very, very difficult. I hope that would change in the city now, passing the law with gender X, that you can have an M, an F, or an X. Maybe that would expand the possibilities in letters, and we can use gender non-binary as an identity that needs surgeries too. So, thank you for sharing that. Yves?
Oh my gosh. I guess I would have to say I too avoid doctors for a lot of learned behaviors from my Black and immigrant families, knowing that there's been a long stemming distrust of health care. But with that said, I suppose I've had two experiences I could mention. When I started estrogen, again at Cal Nord, it was such a seamless process. That first time, I have no idea how, for me discussing, with my peers, they were all shocked that I could walk in having gone there for not really any sort of consultation, but having done a lot of therapy around the subject and counseling around the subject, but still just kind of getting on my prescriptions and then just leaving with my prescriptions, and then just still having the ability to wait or to start or just to have them in your hands. It just was so liberating, I guess. Just my pills and my pamphlet and a little letter or whatever. But I guess similarly, it's really hard. I'm gonna keep coming back to self-definition because it's just so hard to imagine that you have to erase part of yourself to maintain that sort of ease as far as healthcare providers goes. I can't exist as a non-binary person all the time because my identity is treated as a clinical, in some cases a disease, as if I that I'm struggling with dysphoria and that's why I'm on estrogen, as opposed to being a person that wants to be on estrogen because I want to be an author of my identity. And so that can be really hard. But with that said, I feel that's something that will in time change and is not the biggest thing on my agenda of things that I'm fighting for. But that's my piece.
Thank you. I think you touch on a very important thing is that dysphoria, and I feel doctors and medical providers love the terminology, and it's a good thing, but it can be a bad thing. I remember I was pressed so many times to be dysphoric. Oh, you're dysphoric, right? You hate your body, you hate your parts, and I'm oh, I'm totally cool with my parts. They're there, and they're part of my body. Sometimes I do people and I don't want to say every trans person is not dysphoric, because I know I have friends that are dysphoric and they experience a lot, a great sense of disliking certain part of their bodies, but it's not the case of everybody. And so I'm just like I'm in the same boat that you are. Like hormones just kind of help me do and manipulate my body and my being in a way that makes me feel more comfortable about who I am. I also like what you said, like about your sexual appetite or the ability to provide an erection, for example, on estrogen. And sometimes an erection may be necessary for the kind of sex that I have, that I like to have, and not being able to have it because of estrogens. And then like the only alternative is to take another pill and take Viagra. But getting Viagra from the pharmacist with an F in your insurance is a nightmare also. So I guess again, I'm just hijacking the whole thing. Tell me, Dr. Murayama, as a medical provider, what works for you with trans people and what doesn't?
Oh.
Yeah, I'm putting you in the spot.
Seat,
Yeah.
I think what works for me as a provider is actually allowing people more to talk and to hear their stories and to hear how they prefer to be identified. And one of the things that Cecilia and I were just talking about the other day was what might be helpful is to have an organ assessment card and then have a conversation. What it would be is an organ inventory, so it would tell us, me as a medical provider, at the beginning, what anatomy is present and what isn't. And then that gives us the opportunity to actually have a conversation about, well, I see you have this here. What do you refer to it as? What's the word that you use? And then I'll use the same words to make you feel comfortable. But it helps when I know what we're talking about. And I think it helps when I use the words that you folks are feeling more comfortable with.
Yeah.
You train me well.
Yeah. Yes. Me and my team, my group of people working at GMHC, we're working on a body map, so we can just help providers understand how we call our body. And that comes from like a training that I did, like with this person, like was talking about. She was talking about her back hole, and she called it her pussy, and that's how she called it. So she was talking about her pussy, and the doctor understood that it was that she had surgery and she had a vagina. And then when the provider found out that she didn't, that she was calling her back hole her pussy, he got mad at her and make her feel like really horrible. So I feel like I always think how difficult it is to navigate terminology with medical providers when we don't have the bodies that they expect us to have. So I think that may be part of the conversation, lower your expectations about my body because it's mine. Yeah, you go.
Yeah, so I think it would be helpful for the medical folks in the audience and for the folks who aren't here but on the camera to hear a little bit more about what happens actually before you see the doctor, what works for you and what doesn't work, and how can we make it better?
Meaning, going to the doctor is what I was talking about, my experience. My experience with the doctor wasn't a problem. The problem was the triage nurse. I don't want to say that she's the problem. She didn't have the information that she needed to have. And sometimes front desk people can be very difficult. So how is everything before going to see the doctor?
Can I say it?
Yes.
Yeah. So I would say just when I go see a doctor, like any patient, I would like to have a respect. Because once they look at me as a woman, once they see the chart, it's different. They immediately judge me, and sometimes judge me because of transgender, we're a sex worker or sex object. And then immediately I've been treated differently. And that's hurtful. And I don't, I'm sorry, it's emotional, but I just wanted to, respect is what I ask for.
Yeah, there's that plays a role. I usually have like very bad experiences with Frontex people, and depending if I'm in a good mood or if I'm in a bad mood, it can go like really good or it can go really bad. And you know, at the end of the day, the only one that end up paying the consequences is me, because if I get mad and I leave, who doesn't see the doctor? Me. Who doesn't take care of her body? Me. Who may be putting herself at risk? Me. So it's very, very difficult. Yeah.
Yeah, I agree. A lot of the ways when I first go to the doctor, before anybody really even says anything, I just lay it all out there so I can know whether I'm stealing myself, so I can like brace myself for whatever may happen next, so we don't go halfway through the appointment and they're like, that's not quite right. I don't understand that. So that way I know and they know coming in, so I can gauge the experience that I'm about to have, which I guess reaction is quote unquote appropriate for me to see the doctor. Because again, if I don't go to the doctor, like Cecilia said, who hurts? It's us, at the end of the day.
Yeah, so we're gonna open the floor a little bit to see if you all have some questions for us. Yes. Oh, you're gonna have to come to the front, and unless you can, we can just bring it to you. But if you can, it would be great. Don't be a shy doctor.
Thank you guys so much for coming. I really appreciate it. I'm just kind of wondering how you look for your healthcare providers, and if there's any like resource of like a list of people you can go to who will be respectful and won't judge you for just your experience of being a person.
Anybody want to take on that? I ask. We have like our own networks, and now with social media, it really helps. Like most of like the time when I go through my social media, specifically on Facebook, it's always like some trans person saying like, hey, I need a neurology that is not gonna be an a-hole. Where can I go, right? So, the people start saying, oh, I go here and I have a great experience. I go there and I have a great experience. So, I think like, we really, when it comes to looking for providers, we really talk to each other a lot. I also happen to trust my doctor, my PCP. So when my PCP says like, I have, all my patients have had good experiences going here. So, and she also say like, I can't guarantee you that everything will be fine, but, other people have good experiences. So I think like we talk a lot about in between us, and like also it's a lot of like, queen mothers that, I used to be one of them. I took a clinic with 9 patients, and 4 years after when I left, I had 625. And I think that was mostly because I was there. Of course.
I guess just to piggyback on that is that we're all like speaking to each other, and that there's like a lot of word of mouth or word to mouth.
Yeah, word of mouth.
Word of mouth. And so, we're probably talking about you. So, like if you are not on top of it, whatever it is, what we need, then, we're very aware of that and willing to share that, and oftentimes willing to like mobilize in such a ways that like in a harm reductive way to avoid you. So, these are things that I'm sure you should value as much as we do.
Also, I definitely agree with the social media thing, but I think that also pertains to knowing that you have a large community, especially like in New York City. So when I first came out, where I went to school was in Fredonia, which is out in the middle of nowhere, Western New York. So I ended up having the only like available doctors were either in Buffalo, Albany, or New York City. So it's a lot of was trial and error. Like, I'll try the people in Buffalo. I'm like, oh, yeah, they kind of suck. All right, well, I'll try the people in like New York City, even though that was for me at that point a 10-hour bus ride. So I'd go down overnight, go to Colin Lord, go back up that night. But that's, you know, it was figuring out what doctor works best for you and getting yourself to a place that actually had doctors.
Yeah. Any other questions? Yes.
Well, actually, can I build on that? There is an organization called the W Path, and I know that they have a listing of providers that are supposed to be trans and non-binary friendly. Anybody on this panel ever used that? No.
No.
Oh, well.
Hi. I guess first off, thank you guys so much for coming and sharing your stories. And it's just so helpful to hear directly from patients on like what works best. So I guess I have two questions. So defining your own gender is one of, I'm really bad with names. So one of the panelists has said how you struggled with defining your gender and your identity in an early age. I guess as family doctors, I'm not a doctor, but for family doctors who have this model of caring for patients throughout their whole lives, I guess what can they do to help facilitate people who might be questioning their identity? What can they do to make it a better and more supportive time for this person? And then secondly, I know that the LGBTQ community faces a lot of trauma. There's a lot of more incidences of violence. And so kind of with that, from a trauma-informed care perspective, what do you wish clinics, clinicians, anybody involved in the spectrum of care that you might receive, what improvements could they make to make it a more comfortable and inviting experience for you?
I guess I'll just start by saying, I guess as a child, I wouldn't know because I didn't actually experience this, but I'm assuming that, you know, taking the language that you use to condition someone developing as a human being, like especially when you're considering like pubescence or even just like even earlier than that, there's just like so many language barriers that really do mold how you think, what you think your potential is. Like oftentimes my pediatrician and like, you know, kind of had created a timeline for me that at some point I will go through these changes and then I will be this thing, which for a lot of reasons was incorrect, and that like I went through my first puberty very late. And so, you know, I spent a lot of my childhood like thinking back on this like timeline and being like, I'm not aligning with this. And that additionally, my mind is not in a place where I don't think that other kids are thinking about whether or not I'm, you know, or whether or not I'm going to develop in a specific way, like in a way that like my pediatrician considered or my doctor did. So yeah, I think that like it's a lot about language for one, which I'm sure that there's just gonna have to be some sort of other training that people will have like some sort of harm reductive like training to like develop in like talking to young people about their bodies and what they can be, what their potential is. But for the second one, I really couldn't tell you.
I just, I have a friend that does psychotherapy for trans children, and I'm just when she, when they told me what they do, I'm like, I can't believe that somebody is providing psychotherapy to children, because I remember going to a psychotherapy as a child and like clearly know that I'm going to lie about everything that they ask me, because I don't want them to know who I really am, because I'm scared, because I know that I'm not, you know, what they want me to be, you know. And again, this wasn't in the 70s and 80s, right? But I think, you know, we are in a point where, like, you know, self-determination about our identity is becoming much broader than what it used to be. You know, I'm from an era where, like, you know, transness, you know, the acceptable idea of transness was a very binary idea. You know, I actually believe that most of the changes that I did to my body to look in a certain way were pushed to that view of like, the only way to be trans for me was to be a trans woman. And I actually now at this point in my life, I'm doubting if I'm really that far into the feminine spectrum, or it was, this, need to look and identify as a woman to survive and to be accepted. So I think one of the best things that we can do is just, allow everybody and every patient to, feel free to identify as wherever they are in terms of gender without pushing towards a binary idea of gender. And in terms of trauma, I do have my own trauma, and it's, very hard for me to, it's so much of an intimate experience to go to a doctor. Just, the idea that for you may be so simple to say, just take your clothes off. It's like saying a double espresso cappuccino at Starbucks, right? It's just the same, right? But for me, as a patient, take your clothes off comes with all this putting myself in this vulnerable space with somebody that I barely know is gonna come, and it's not only gonna see my body, but it's gonna touch it. And it's gonna touch it in places where I was touched in ways that I didn't like. So it's gonna, look at my body in ways that, I've been looked at in very not so positive ways. So, it is such an intimate experience. And, and I understand you all have to do all of that in 14 minutes. I don't know, what is it? And also take notes and prescribe and take my heart, my blood pressure. I know that it's a lot, and we don't have 2 hours for me to get comfortable, but, we have to at least think about it.
So for me, when I was, again, well, I'm oldest, I guess, so that I have more experience. So when I was 5 or 6, my mom told me, I don't even remember, but she said, I like to put red lipstick on my lips all the time. So I was always stealing my mom's lipstick and put it on the lips. And then my mom, because of a generation, it's after the World War II, she's 83 or 4 now. So for her to protect me, it was, no, you are a boy because you have a penis. So you're not supposed to do that. So throughout my young age, I was often told, because I have older sister, and she can get everything what I want, but I cannot get what I want. So that was very difficult. So I think at that age, I think just respect and let that child be who they are. And I also love to wear high heels that my mom had. This chunky, but it's really high heel with the red lipstick. That was me. I wish my mom let me do that, and my life would be so much different. How? Probably because when I grew up, because of the situation, that I would be able to recognize myself as a transgender, and maybe I have transitioned much earlier, so that I don't have to have this craziness on top of puberties and my life. I don't have to worry about that, and I can concentrate on my career instead.
I have this funny story where I thought I was a UFO for many years, because my brother told me that they found me in a railroad, and I believed him. And I'm from a part of Argentina that has a lot of UFOs. So in my mind, I'm like, oh, they left me here by mistake. Yeah.
Maybe just to piggyback on that, is that also sometimes in an office situation, that it's very rare that you ask a child who they are, and sometimes, of course, I don't think your doctor will be able to see certain symptoms or symptoms. That's also so messed up to imagine that, like, you know, that a child wanting to explore the limitations of who they could be is symptomatic of anything. But that to say just that sometimes it's just as simple as a name and like what name that child is. Kids make up new names all the time. I remember I was shunned for it. Like whenever I picked a new name or something like that, and now I picked one and it's sticking and I want to keep it, and we'll have to go through all the different channels to change my name at some point in the near future. But additionally, you know, to also say that a child could start hormone replacement therapy earlier, it saves them so much strife at times, and it's not really for all of us to assume that a child doesn't know what they want. You know, and I know some trans folks who started hormone replacement therapy at like 12 and 13, and looking at how tremendously happy they are, and me having started hormone replacement therapy at like 21. Just knowing that just comes with a lot more reconstruction that I have to kind of now, after getting a passport, for example, have to get a new passport, and that like I have to, you know, I'm not on my parents' insurance anymore, so now I have to make sure that I can stay on my, I know, right? That I can stay on my prescriptions and stuff like that. And this is not like, you know, just as medical providers, this is you as aunts and uncles and parents, I'm assuming, that, you know, that your child very well could be thinking about a lot of things that you might not want to be thinking about, or that perhaps you're just not hearing. So I remember when we started this discussion, we were talking about just listening and being able to listen with the heart and the mind at the same time. I think that that's definitely a good seat a doctor could be in for anyone, and you should all do that.
I think like sometimes as medical providers and those that are in more of a younger side or in a progressive side, and you know they have you know an understanding of transness, and you know, and they see the world in the way that I want you to see it, you know, that they also tend to forget that some of us come from, you know, times where transness wasn't accepted, and like, you know, and sometimes like being overly understanding can be shocking, right? And like, you know, it's okay, just I understand that you know what trans is, but you don't have to let me know, right? That you are all of that.
Yeah, I just want to add something that as providers, we sometimes want to say the right thing, the right way, at the right time, or all the time. And, you know, mistakes are going to happen. We're going to misgender people because it happens. And you heard Cecilia misgendering somebody, and she just moved on. And so I think it's important, if you do a whoops moment, to just say, oh, sorry, and move on. Don't explain and go on and on and on, because that just makes things worse.
I know. One time I provided like misgender me in front of somebody, a group of people, and like the misgendering wasn't as bad as her apology. Like she took like so much time and effort apologizing that she put a lot of attention over me that I didn't like, and I love attention. But that wasn't the attention that I wanted to have. And like, you know, sometimes like, you know, it's not a big deal. You just correct yourself and go. And I think like, yeah, I think we have time for one more question if anybody has one.
Hi, my name's Joe Lorio. I'm a 64-year-old cis male family physician, father of a trans person.
Yay!
Yay! All right, I didn't hear any gasping on my age. I'm sorry.
Oh, God.
All right. I just want to make a comment on the issue of some of the social media and people commenting about, you know, good or bad doctors.
Yeah.
I think that's a very binary way of looking at physicians. I think that, in fact, there are some good and there are some clearly bad, but I would say there's a lot of fluidity in the medical community, not just physicians, but also nurses. And I think how you can steer your way to encourage a better relationship from the beginning. It's a difficult situation. A lot of times doctors and nurses are rushed and trying to do the best thing, oftentimes failing. Having a situation where you can start things off on the right foot. I remember sometimes that there's some of my hearing impaired patients who will have a card which is very clear saying, I'm hearing impaired, I can't hear what you're saying, all right? I can partially read lips. There's information that they can provide in a concise way which gets people off to the right foot. And I think we all have to learn to take those clues, but in a situation of stress on everyone's point, we need to find different ways to initiate the relationship so that people can be steered toward a more beneficial way of conducting business.
Cool. I did have a couple of those experiences. I have a PCP and I have a doctor around the corner that I run to see when I have a flu or just something really. And like the doctor around the corner had a real hard time understanding my body and my medication. And when I told him that, that I take estrogens and sometimes I take Viagra, he just couldn't understand it. And we grew together to the point where he is in a better place now. It took some effort and I chose to do that. But I also I feel like, trans people are always put in the place to educate providers. And sometimes we're tired. Sometimes we want providers to already know. Because, healthcare is too expensive, so my insurance is paying, and I'm usually paying a copayment to go and educate you. So.
Thank you. Thank you very much. Just a couple of closing comments. One thing I realize about this is, although we talk about training and sort of learning how to use the right words, I think one of the things that we also forget is that we're all human beings who bring our own feelings to this experience. And I think what you're highlighting is the challenge for us, both as providers and educators, is to understand that this is training, not just learning how to use the right words, ask the right questions, but how to be present and how hard that is. Because people bring their own feelings and judgments to this. Mm-hmm. And we have our work cut out for us. And I think part of that challenge is people who feel vulnerable often feel they have to bear the burden of all of this. So we need to figure out what kind of training partnerships that we can develop. You have so much information and experience that can help us as individuals. So because part of being a really good doctor is being present. Part of being a really good nurse is being present. And I think part of what you also highlight is when you operate facilities, helping the rest of the staff feel just as comfortable. Because if you highlighted, all the visit starts at the front desk. And if that experience is difficult or unpleasant, it really alters everything. So those are some of the takeaway messages that I think, we have to figure out how to train in a really profound way to get people to feel more comfortable. And just as another comment, I think you've also you've identified areas of advocacy that we, both as an organization and as a profession, can work with you around healthcare costs, how to deal with the gender issue. We have some issues actually around our professions where your professional name is your license, and if somebody decides to change their name, the challenge of even healthcare providers who are sharing some of the similar issues. So there's a host of things around training and advocacy that I think that you've highlighted, and thank you really very much. We need to do more of these. So hopefully you will come back and we'll share some more stories and help us, move the whole healthcare system into the place that it really needs to go. So thank you very much.